Now, on the IMpower studies on lung cancer, as we're focusing on at the moment, and here with me to talk to us is Professor Pilar Garrido. Hello to you.
Hello.
What would you say about the IMpower studies with reference to lung cancer?
Yeah, I think that immunotherapy works in patients with lung cancer, and this is a very good news for our patient because today lung cancer is the first cause of cancer death. And when receiving chemotherapy, most of our patients died after a median survival time of around 1 year. So IMpower is related to the studies focused on the role of atezolizumab in the setting of first-line use of chemotherapy in patients with lung cancer. And in this meeting, we have known the result of 2 studies focused on this combination. According to clinical guidelines, and the ESMO guideline has been recently updated, we already know that we can use immunotherapy in the first-line setting. We can use a drug named pembrolizumab in the subset of patients in which the PD-L1 status is greater than 50%. And we already know that we can use pembrolizumab plus chemo or atezolizumab plus chemo. But in this meeting, we have learned that different combination of chemo plus atezolizumab can also be used.
And what are some of the challenges in using immunotherapy drugs in lung cancer? Are there any side effects, or does it not work in many patients?
Yeah, very good question, thank you. We have different challenges. One focus on the learning curve of our colleagues in terms of the immune-related adverse events that are really uncommon, but we need to know how to manage. And the other type of challenge are related to how best select the treatment based on different biomarkers. And in fact, in this meeting also we have learned about some kind of biomarkers, for instance in blood, because for us tissue is an issue in lung cancer. So we need to know more about biomarkers, but in general it's key to identify the best patient to receive each type of treatment.
And what more do you need to know about biomarkers?
Yeah, I need to know probably the PD-L1 status, that is the biomarker well studied now, is not enough to identify all our patients, because in some studies PD-L1 is not enough to identify patients. So we need probably a set of different biomarkers, and it's a very dynamic situation, so we need to have more information about tissue biomarkers and blood biomarkers.
Well, Professor Garrido, thank you very much.
Thank you.